Some of the chemotherapy regimens that we use for patients with colon cancer require them to receive chemotherapy over the period of 2 or 3 days at a time. And that's where the role of Port-A-Cath becomes really important. Let's talk about that. Port-A-Cath is a chemotherapy catheter that is, as the name says, port means portable. It's something the patient can go around, do their thing, and doesn't have to worry about it, doesn't have to get it disconnected every now and then. So it's an easy intravenous access, and that's the way it helps us administer chemotherapy. A lot of patients who are on prolonged chemotherapy regimens, their veins get burned, and eventually we lose that IV access. So that's where the role of Port-A-Catheter comes in. As I said, it's portable, and I always tell patients they can go about their business, they can go to work, they can even swim in the pool when it's, when the cath is protected adequately. They get teaching about how to protect their catheter. And it's something that can come off after the chemotherapy is completed. That is a decision that's made between the patient and the physician. Some patients like to get rid of it as soon as the chemotherapy is completed. We usually like to keep it in a little longer just to make sure that we don't need to do more chemotherapy. But it can stay in from 6 months to 6 years, and it's fairly easily maintained. The only thing is a patient needs to come once a month to get it flushed, and that's about it.
For an interactive tool to learn more about your colon cancer and your personalized treatment options, go to mycoloncancercoach.org.